Good morning, my dear students. Today we are going to discuss on shoulder joint examination. This is again the first video of 3 video series on shoulder joint examination, and here we are trying to get the main steps of shoulder joint examination into our head. It's important to understand that shoulder joint examination is an orthopedic procedure and you have to follow the sequence of look, feel, move and special tests. Let's start with look. So there you are going to look for the shoulder joint abnormalities. The important thing that you have to remember is you always have to compare the affected side with the opposite side, and your inspection start from the sternoclavicular joint. You follow along the clavicle and then come to the acromioclavicular joint, and then you inspect the area of shoulder joint. Then you move onto the lateral aspect, then onto the back to complete your inspection by looking at the scapula and the related muscles. Then what are the things that you are going to look for? You are going to look for any swelling, obvious masses, fractures, deformities, defects and visible features of inflammation, and also you are going to look for surgical approaches, scars and arthrotomy entry points. For that you might have to ask the patient to raise the upper limb and look through the axilla. Then we will move into feel component. Again, you have to follow the same sequence starting from sternoclavicular joint up to the scapula. So when you are palpating, you are going to palpate for warmth, tenderness, defects, masses. An important thing that you have to remember is you must palpate for the coracoid process, which is usually lie beneath the distal half of clavicle. And also you can't forget the spine of the scapula apart from the borders of the scapula. Then you will move into move component. The first thing that you check in move component is you have to look for winging scapula. For that you may ask patient to press against the wall and you can observe what is happening with the medial border of the scapula from behind. And then you are going to check for the shoulder joint movement. The best thing is to ask the patient to copy what you are doing and you can continue on movements. The important thing that you have to remember is the 180 and 60. They may not be the exact correct values, but if you remember that two figures, that will be adequate at your clinical practice as well as in the exam. So you will first check for flexion of the shoulder joint, which is usually 180 degrees, then the extension, which is usually 60 degrees, then abduction of the shoulder joint, which is usually 180 degrees. During the abduction, you have to ask for pain. So painful arc may be a feature of frozen shoulder or shoulder joint osteoarthritis. In advanced frozen shoulder, patient may be having restricted movements, and you always first check for the active movements, and if patient fail to complete the active movement, you have to complete it with the passive movement. Then you will be checking for external rotation, which is again usually 60 degrees, and it is very important to make sure that the elbow is held nicely against the lateral aspect of the body when you are checking for external rotation. Then you will be checking for internal rotation. For that, you have to ask the patient to raise the thumb as much as possible through the midline of the back. The patient should be able to raise the thumb above the lower border of the scapula to say adequate. Then you will start to check for power of important specific muscles. You will be starting from the subscapularis, which you will start in the same position where you have checked the internal rotation. We'll ask the patient to press your hand against your resistance away from his back. Instead of that, you can try belly press test. Then you will be checking for the power of both teres minor and infraspinatus together. Technique you can be seen in our next video. Then you will be checking for the power of supraspinatus. After checking for these muscles, then you will move into special tests. You will first check for impeachment. For impeachment, you can do empty can test, and also you can try with Hopkins test. Then you will check for integrity of acromioclavicular joint. That will be checked with cross arm test or Scarfa's test. Then you will move into check for stability of the shoulder joint. Shoulder joint stability can be checked with 3 tests. One is anterior and posterior drawers test, then the sulcus test, and finally the apprehension test. If you found any positive signs in this shoulder joint stability tests, then you have to check for 2 things. One is you must check for axillary nerve injury. For that, you can check for deltoid function or the abduction power of the shoulder joint, and also you can check for regimen badge anesthesia sign. And the other test is the test for slap lesion, that is called O'Brien's test. So these are the key steps of shoulder joint examination, and I hope you will be able to get the general idea and the sequence of examination. Then you can watch our next video on techniques of the procedure. Thank you.